My name is Shannon Lears. I'm a student nurse, and I'm addressing Kimberly Garner and representing House Bill 1839, which was proposed on August 28, 2016. This bill requires all healthcare professionals to complete cultural competence training in school and as continuing education for certification and licensure. This bill states that schools for healthcare professionals shall include instruction in cultural competency and should provide continuing education training in cultural competency through classroom instruction, workshops, or educational programs provided by the school. In the educational training proposed in this bill, students would learn knowledge, skills, attitudes, possibly cultural languages, information about different cultures, all of this information that would be vital to taking care of patients from other countries and different cultures. I support this bill because it is our job as nurses and healthcare professionals to provide all patients with excellent and sensitive care. One of the most important components of nursing is patient-centered care. In the Professional Nursing Concepts textbook by Anita Finkelman and Carol Kenner, they state some of the most important components of patient-centered care. It is our job as nurses and healthcare professionals to identify, respect, and care about patients' differences, values, preferences, and expressed needs. It is also our job to listen to, clearly inform, communicate with, and educate patients. First of all, this can be a very difficult task and a language barrier between the healthcare professional and the patient. It is possible that with these cultural competency training courses, some language can be taught from different cultures. Also, background history, spirituality, values, preferences from different cultures could also be taught so that healthcare professionals and nurses have a better understanding of what this patient from another culture needs. These authors from the Professional Nursing Concepts textbook also point out that nurses view patients through their own personal experience and history. If they do not understand the history or even have knowledge of history of other cultures, it will be very hard to be able to relate to that patient. They also state that this could cause misinterpretation of communication and behavior of the patient, and it could cause inadequate planning and implementing care that the patient is relying on us for. The Taylor Fundamentals of Nursing textbook provides some good information on the different values and preferences of certain cultures. For example, personal space could be very important to some people in certain cultures. If others don't consider the personal space of a patient, that patient may become angry or uncomfortable. Also, nutrition, food is different in some cultures. And if there's a preference that a person from a certain culture has and the hospital does not have that food, it could put them at risk for nutrition inadequacy. Also, in many cultures, people view the needs of their families as more important than their own needs, and sometimes they won't even share private information about their families to healthcare providers. Not only is it important to assess their values and preferences, it is also important to be aware of the common health problems of people of different cultures as well. For example, in Asians, common health problems are hypertension, stroke, sickle cell anemia, and the lactose intolerance. In Hispanics, diabetes, lactose intolerance, and are some common health problems. And in Native Americans, heart disease, cirrhosis of the liver, and diabetes are common healthcare problems. So in these cultural competency training courses, they could even go over many of the common health problems that nurses should be aware of when they are taking care of this kind of patient. In conclusion, I support House Bill 1839 because it is important to establish a healing nurse-patient relationship where all needs can be understood, communicated, and cared for. Adding cultural competency into the course requirements will allow nurses to help all patients in their road to recovery.